Hello, this is Doris Vick with MedAdvantage Resources. Thank you for joining us on the How to Code CPT for Cardiovascular Surgical Procedures. I'd like to begin by asking one simple question. Do you know how to use the American Medical Association CPT Professional Edition to code cardiovascular surgical procedures anatomically? Consider this. Surgeons specialize in performance of surgical procedures within an anatomical body system. This same logic is represented in the structure of the CPT coding manual. I'd like for you to begin independently by listing all the organs or parts within the cardiovascular system. Once you have these in a list, then organize your list in an anatomical order. For instance, list the parts within the heart, list the arteries, list the veins. Once you've completed the list, confirm it by the table of contents at the beginning of the CPT cardiovascular system as a reference point. The table of contents lists the organs in anatomical groupings. The cardiovascular CPT codes begin with the first digit of 3. They fall within the range of 33010 through 37799. Each of these codes is unique to a surgical description and is assigned in anatomical order. The table of contents is a great reference point in your CPT coding manual. The organs within the cardiovascular system are listed in red text. It also uses blue text to identify the surgical processes. Spend some time looking at the table of contents in the organization of it. Also, flip over to the code listing and the descriptions. These common surgical approaches or surgical procedures are fairly consistent within each organ or anatomical part. Using the table of contents as a reference point, explore the common surgical approach or surgical procedures or processes. Within the CPT Professional Edition, illustrated anatomical and procedure review listing for surgical procedures is a quick reference. You'll find this at the beginning of the CPT coding manual. This reference provides a surgical suffix, the meaning of the suffix, and gives an example as an explanation. Variations of surgical procedures are defined within each specific code description. Confirm the code description with the operative report or surgical narrative from the surgeon. Once you've completed this with the appropriate code matching the documentation, then review for any appropriate surgical modifiers as defined in Appendix A of the CPT Professional Edition. There's one other area that we'll cover in a separate presentation, and it is Appendix L. It's extremely important that you flip back over into the appendixes at the back of the CPT coding, find Appendix L, do some review on that. It does correspond with the cardiovascular surgical procedures section. It is also, once you learn how to use that, a very valuable tool in coding cardiovascular. We'd like to thank you for joining us for the CPT for Cardiovascular Surgical Procedures. This is a conclusion of the review. If you found this information valuable, check out other topics on our blogs. If you're interested in trying a medical coding class, we'd like to offer you a free HCPCS Level 2 coding course. We regularly charge $100 for this particular course. It's yours to review how and learn how we train our students at MedAdvantage Resources and support with mentoring. This free offering does include mentoring, so give me a call once you register if you have any questions or need clarification. Thank you.